morning to one and all, respected guest of the day, Dr. Abu Hassan.
Yep. Good morning. Good
Uh,
morning.
Good morning, sir. Good morning. All the day, I welcome Professor Abu Hassan, member Malaysian Medical Council. He is going to deliver a talk today in the first session, and I also welcome our convener, Professor Bala Muralidharan, the one of the session chairs, Dr. Mahima, of the conference, and I also welcome all the delegates who have been contributing to this 3 days international conference on medicine, advances in medicine, science, engineering, and management 2024, organized by New Research and Innovation Society. So we are happy to have our honorable doctor here for the first talk. Before his talk, let me shortly introduce our speaker, Professor Datto Sri Dr. Abu Hassan Azari Abdullah. Uh, is a very well known medical practitioner in Malaysia who is named as the father of modern emergency medicine of Malaysia for his effort in the redevelopment and establishment of emergency medical and trauma services in Malaysia. He was trained as a trauma surgeon in the UK with a scholarship from the government of Malaysia, and he became the first trauma surgeon in Malaysia. He was appointed as the head of emergency medical and trauma services of the Ministry of Health, Malaysia, when he came back from United Kingdom in 1992. And while in that position, he successfully established a well-organized emergency medical and trauma service system, Universal Access Number 999 system, and also the specialty of emergency medicine in Malaysia. Because of the great achievement, he was appointed as a consultant to the Ministry of Health and a few other countries too, including Indonesia, Sudan. After his retirement in 2017, he joined the corporate world of healthcare industries, heading many corporate bodies both in Malaysia and other countries. So currently, he is heading a Maju Healthcare that is focusing in the redevelopment of Kuala Lumpur Hospital and offering outsourcing of medical services for the Ministry of Health Malaysia. Apart from that, he is appointed as chairman and board of directors of several other companies, including Anta Holding, Sihat Holding Malaysia, Herbit EECP Malaysia, etc. So he has uh, got various professional qualifications and experiences. To say a few, he was a founder, head of emergency medical and trauma services of Ministry of Health Malaysia from 1992 to 2010. He is former head of emergency department, Kuala Lumpur Hospital from 92 to 2017. He is a visiting consultant in emergency department of Kuala Lumpur Hospital. He is a visiting consultant to Rumah Sakit Cipto Jakarta, Indonesia, advisor and consultant, Ministry of Health, Indonesia, advisor and consultant, Ministry of Health, Sudan, etc. And he is professionally helping various statutory bodies all over the world. So we are honored to have him, Professor. We are honored, very much honored to have you here as keynote speaker of this conference. We welcome you, sir. Now the session is yours, sir.
Thank you very much. Thank you very much. Thank you for the kind introduction and greeting from Malaysia. Well, first and foremost, I'd like to thank the Mr. Dr. Kamaraj and the committee for inviting me to speak, and I am most honored and privileged to share my presentation today. And just to mention to everyone that my presentation today is something related to one of my projects, and this project is entitled digitalization or digital transformation of healthcare for Malaysia. And I also presented a paper for the Malaysian transformation of healthcare for digitalization, which is entitled Uberization of Healthcare. But basically, one of these, what we term as the way forward for the advancement of healthcare in many countries in the world is in relation to digital transformation, and this also in fact enhance or otherwise what we term as the
Doctor,
legacy.
shall we, excuse me, Doctor, shall we
Yeah.
share the PPT?
Yes, please do. Yeah,
Yeah.
I'm just
Balaji,
yeah,
Balaji, please share. Please
yeah,
share.
yeah. Just this again, I just want to mention that it is the legacy of COVID-19, where online activities have been created as a culture for a lot of our activities, and precisely why I'm now have to propose the way forward. Now, you have introduced me well. Thank you very much. And I have been, in a way, committed to a creative and innovative way forward. And this is a topic that we are discussing today. Now, to begin with, the impact of digital transformation in healthcare is all positive, and in fact, it's all created for the purpose of facilitating healthcare. However, we are now discussing about the impact. Some of it is positive, but we have to bear in mind that also what we term as a challenging or maybe negative also to some of the prospect of the millennium generation in their psychological integrity. I would like to emphasize the point that in what we term as the registered medical practitioner or doctors in many countries, especially acute care personnel, in some ways have been in a way impacted by the digital technology. I will first begin with introducing the topic and by a definition and terminology. Now, the next slide, please. I will define for you all the what we term as acute care personnel. I pick up this component, acute care personnel, although digital transformation have affected or have benefited healthcare in general, but acute care is a branch of medicine that manage a short-term but severe medical need, especially during emergency situation, critical care cases, example, pre-hospital care, major incident management, emergency services, intensive care, which is characterized by very challenging, high risk, high emotions, demanding, and during odd hours, and exhaustive. Now, I pick up this perspective of acute care simply because the personnel of acute care requires a highly skilled and competent individual with robust and resilient psychological framework. Most important, very strong emotional intelligence, and of course, will have to be a team player. Of course, have to have an able physical strength and with work smart and safe skill. Now, this in totality requires a personnel which have got a kind of a different or more robust and resilient physical and psychology. So, precisely why we have to now, next please, we have to now identify what are the perspective of this, what we term as the effect or impact of digital transformation in healthcare. Next, please. Can I adjust? Can I change myself or hello? Next, please. Yes. Now, if you look at the scenario like this, for example, definitely we need a very strong psychological framework with high emotional intelligence. Next, please. Yeah. So if you look at this search and rescue work process, it's very complicated, risky, and not for untrained medical personnel, and also not for a weak psychological individual. Next, please. Yeah, facing a very what we say emotive and very high demand scenario. Next, please. Right. So if you look at what we talk about digital transformation just now, digital technology have radically changed healthcare delivery system. Of definitely it improve the performance and efficiency and accessibility of healthcare. In actual fact, it's almost inevitable that we now have to move because of the digital revolution that will improve accessibility and management. And as I was saying, that it has a lot of benefit. And I have presented a paper entitled Uberization of Healthcare. Next, please. Now, there are many features. Generally, there are a lot of what we term as technology, which I will not discuss today. Just to mention that the number 8 is so crucial. Artificial intelligence or machine learning, which actually have been the technology that have been depended upon in many of our work process. Next, please. Right. In Malaysia, the government is very committed for digitalization of healthcare system. Next, please. Now, it focuses on patient and digital health innovation. Next, please. Now, we have, of course, implemented 5G, which drive Malaysia digitalization. In fact, telehealth, remote surgery, transferring large medical file, tracking patient movement, all these have been facilitated very well by 5G. Next, please. Now, our Prime Minister have mentioned quite clearly that the country digital transformation is related to artificial intelligence literacy, and he actually proposed that all universities and colleges in Malaysia engage in developing artificial intelligence in the medical education, oh, sorry, in education delivery system, not only medical, but in all education delivery system. Next, please. Right. So now let's talk a bit about artificial intelligence. Artificial intelligence is the ability or computer control either robot or machine to perform tasks which usually only could be performed by human. The intellectual processes characteristic of humans, such as the ability to reason. Now, it is also capable of performing complex tasks, reasoning, making decision, and solving problems. This ability to perform cognitive function actually usually, as you know before, is related to human ability only. Now, perceiving, reasoning, learning, interacting with environment, and problem solving are all now the ability of artificial intelligence. AI system actually work by combining large amount of data with intelligent algorithm, series of instructions that allow the software to learn from pattern and features of data. Next, please. Now, if you now ponder, look at what we term as the sweet and the bitter of digital transformation, definitely the advantage which is inevitable, which have gone way forward. In fact, one of which is to reduce manpower. In fact, to save time and efficient, and of course, manage financial much better, eliminating biases and streamlining or to simplify work process, which is going to be faster. And all this automating repetitive tasks can be replaced by AI, decision diagnostic assisting support system, like for example, radiology, pathology, ECG, cardiology are all now quite significantly contributed by AI. But please understand that while we are very engrossed into getting AI to do a lot of our function, there are a lot of other issues that we have to ponder. Now, it is actually quite costly and it will definitely loss of human job. This is the important part. It is lack of emotion and creativity. It will weaken emotional intelligence. This is a very important part that I actually must emphasize the point, what we term as digital addiction, and it reduce capacity of cognitive functions and memory. I will go into more specific about this in a while, but let's have a proper what we call balance of thinking. I'm not against digital transformation, but we have to be aware that there are pluses and minuses. Okay, next please. Now, I just want to mention also about blockchain, which is important. Blockchain is an advanced database mechanism that allow transparent information sharing in the business network, or in fact now in all networks. Blockchain is a database which is actually linked together by chain and it is encrypted. I have to emphasize the point that blockchain is very, very important nowadays for data security. As you all know, there's something called super data black market. People are selling data for good money. In fact, in Malaysia, for your information, the government of Malaysia engaged on what we call the project, which give an opportunity for Malaysians to key in their personal data. It was promoted by the government for a while, but then immediately it fails because of the fact that when you put your data, which is not encrypted and it's not secure, they encourage it. This will encourage scamming and over hacking, and in fact, it has been a big issue in Malaysia now. So blockchain is something that we promote. Next, please. Yeah, and if you look at our Minister of Health, he declared that we are going to move forward for one person, one record under digital health transformation. Now, precisely why, if we have one person, one health, one record, if it is not encrypted in the blockchain, and this data can be is available and people can hack into it, and this data can be sold for good money. Next, please. Yeah, so this is just to say that be careful. The data can be hacked and can be stolen. Next, please. Okay, now this is why now we are moving towards data management transformation into blockchain. Now, like I said, if the data which is not encrypted, the security is not strong, precisely why data become a very what we the risky scenario where people can hack and there are a lot of money lost because of scam in our country now. We are facing a lot of scenario where people are losing a lot of money for all sorts of different type of scamming. So yes, if you want to have data in our healthcare transformation, we must move on to blockchain for encryption, for data security, and so on and so forth. Just to remind that while digital transformation is very what we term beneficial, but the data security is a big issue. Next, please. Right. So we have now three components. One is what we call the communication highway. Now we in Malaysia, the government of Malaysia is going to invest so much on 5G. Now, of course, we have coming out and so many systems, as I mentioned, blockchain, artificial intelligence, and gadget software system are all everywhere in the market. But most importantly, the last component is the most crucial. We must understand that digital network or digital highway is of no benefit if we don't define the application. The application and the transformation of services is so crucial. And of course, I mentioned about digital healthcare transformation, digital education system, and digital economy, and so on and so forth. Now, all this put together, if the data is not secure, it's going to be very risky. Next, please. All right. So, healthcare digital transformation, as I mentioned, we talked about just now about the various components. Uberization, digitalization of ambulance service. All these are my project that I've introduced in this country, in Malaysia. Sorry. Next, please. Right. It is basically the core component is the work process transformation and the application, like I mentioned, with the enabling technology, gadget software, and of course, we must have communication connectivity. Malaysia is a country that has got urban environment. Then, of course, we also have rural setting. Now, unfortunately for now, the communication highway is quite efficient in the urban setup in the city and town, but maybe not so strong in rural situations. So universal access, or what we call equitable access, is also an issue of the digitalization of healthcare. Next, please. Right. So this is the paper, Uberization of Healthcare. Next, please. I presented that this is the ecosystem, which is very, very comprehensive, that include healthcare, even for that matter, what we term as the education system, prevention, and then even the warehouse, digitalization, and all those component, which is very complete. Next, please. Right. Just to revisit the scenario of the impact of digital technology, it affect the brain function well. Let's just discuss about how the digital technology will impact human psychology. Next, please. Right. So the brain function, as you all know, we have different part of the brain. There are about 67 part of the brain. Now we have the left brain that is very technical, which all the analytical thought, stochastic, micromanagement, memory, and so on and so forth. But the right brain is very creative, innovative, artistry, and so on and so forth. Then we have the bridge between two, the corpus callosum and the hippocampus. I put this to you. This is our natural brain, and it has been developed. And those days when we don't have too much of digital technology, we challenge ourselves with a lot of interaction with the people. We move around, we engage with the environment, with the natural scenario and situation. Then every part of our brain develop in a good balance. Okay, now next, please. Now let me just bring to you some of the situation in Malaysia. The impact of digital technology in human psychology have seen certain unfortunate scenario. The attrition or the resignation rate of young doctors, and many students are not interested in higher education, and in fact private university enrollment have reduced, and many Malaysian young are influenced by social media to go into online businesses and activity to earn quick income. Now this is something which is quite worrying. Next, please. Now, sorry about the slide, but just to mention that one of the issue about human psychology. Next, please. Let me just discuss this without the slide. Yeah, okay. Just to mention that the technology have caused some kind of like scenario of the perspective of the young. Now, there is what we term as one of the various challenges. Now, if a young individual spend a lot of time with digital network, that is the handphone, computer, they will gradually develop certain psychological issue. Now, first I mentioned just now about digital addiction. Next, please. Right. Now, this is important that we have identified the issue about the emotional intelligence, which is what we term as digital emotional intelligence. Now, before I go to that, I just want to summarize the two slides that was not so clear just now. The impact to human psychology, if it is not properly done in a good balance, first you have what we term as a feeling of isolation, the weakening of the cognitive functions, the challenge to emotional intelligence, and most importantly, the inability for the interpersonal interaction and relationship. Now, let me touch now about the emotional intelligence. Now, this is very, very important subject to discuss. Now, we have what we term as the real emotional intelligence, which is developed by our natural way of human interactions and so on. But because we have now been impacted by a reduction in human interaction, the reduction of socialization, and the isolation because of the digital technology, there is something called digital emotional intelligence. Now, the critical success in the future generation, the real emotional intelligence is must be developed because this is the ability for the human to manage and understand emotions of themselves and the emotion of the people surrounding them. Is crucial for effective relationship, interpersonal interactions, and communication. There are five key elements of the emotional intelligence, which is real, developed for our generation before we have what we term as a self-awareness, self-regulation, motivation, empathy, social skill. Now, this is when you develop through natural way of the development of emotional intelligence through the different part of our brain. Now, emotional intelligence is regulated by the hippocampus, and it is very crucial that the hippocampus is activated. Next, please. Now, what do we mean by digital emotional intelligence? This is the ability to digitally sense emotional response, our own and other people, to use effective information to guide thinking, behavior, and decision in performing responsibility, which is in the present daily life activity, which is influenced by the digital world. It is the current requirement for us, actually, if we want to now be more effective as an individual, to properly adapt to the complex multi-generational digital community in relationship and interaction, to the educational environment, to be more effective in our education system and in teaching impact. Now, to foster understanding, empathy, enabling individual to connect with others in digital community and on a digital deeper level, whether in virtual or meeting or social media interaction, is important. Now, I have to re-emphasize the point that if we're not aware of the behavior of the millennium generation, if we are actually not aware the way they behave, I have to emphasize this point. If we are teaching, let's say in a medical school, by the method that we used to teach before, without understanding their psychological framework, we may not be effective. This is something that this slide is all about. Understand their emotion, which is influenced by digital, is different from ours. Next, please. Right. So the impact of digital technology to human psychology, as I said, just want to touch a bit on the negative impact. To summarize, they can have depressions because they are into the what we call the world of friendship, which is actually a fake friendship. It's not real. And the communication is one way, only by audio, visual, and a bit of talking, but to a digital world. Now, there is an issue about increased anxiety. Number three is important on social isolation. I've repeated myself in digital addiction, feeling of inadequacy, dissatisfaction, and low esteem. Now, let me explain a bit more on digital addiction. Digital addiction is all about dopamine. Whether you are addicted to drugs, alcohol, pornography, or anything of that sort, and now in this case digital, it's all about the amount of dopamine that been secreted. Now at this time, we may not see this scenario much too much. However, as we continue to allow our young to deal with only digital and lack of interaction, lack of the what we call the natural way of developing their psychology, then later on, digital addiction will impact on human effectiveness or what we term as their psychological framework, which may be weakened. Next, please. Right. So as I was saying, how do we therefore make sure that digital enhancement of human psychology without negative impact? We have to transform our medical education or our education completely, rather than too much of academic, but more of what we term of technical, or what we now have engaged ourselves in what we call competency based medical education or competency based medical practice. Now we have to do what we term as to create simulation skill center, not too much academic, but let them do hands on. And secondly, we have to do what we call the emotional regulation. Now, this is quite important, to regulate their emotion, to make sure that we are aware that emotion may be quite unstable. And we have to come up with more of social engagement interaction module, and physical activity must be mandated in all the development of any young educational program. Management of screen time. It is important that there will have to be a time of no screen time, and it will have to be more of just what we term as direct interaction. And then resilient promoting intervention is also important. Robust resilient psychology framework, cognitive behavioral and mindfulness based intervention. And number six, digital mental health intervention. And as you all probably fully already aware, there's something called WHO digital mental health intervention. Okay, next please. I will not have much time to explain all the detail, but just to mention that these are the component to how to enhance. Now we already touched on this just now about the negative impact of digital technology. Next please. All right, so we have done okay. Now this is a bit of what we call WHO digital mental health intervention, digital therapeutics. This is actually a situation where we can do what we call psycho education, behavioral activation, and all this kind of thing using digital network to deal with their mental health. Okay, next please. Right, just to conclude a bit of my part of presentation, this one is called educating the mind without educating the heart is no education at all. Well, like many of them could pass exam very well with all the A's, and theoretically they can be very good. But that is the part of the brain which is the frontal lobe. But if we want to deal with their competency, their feeling, their emotion, their caring, it will be the posterior lobe, it will be the hippocampus, it will be the corpus callosum, it will be the cerebrum. Now, this is actually where the education must be translated into skill and with a very strong emotional stability, and of course, able to interact with human in the usual human interaction scenario. Next, please. Right. So I have been involved in digital transformation in many ways. So I have actually promoted the concept of the academia in healthcare digital transformation with many of my innovation. Next, please. Okay, so I'm not going to go into the specific, but like I said, we are now having to move to activate the academia. Although digital transformation is very good, but the medical education now have to be transformed to deliberately more having to deal with skill in the competency-based medical education, to deal with technical know-how, simulation, and so on and so forth. So now the academia world must drive towards a balance of digital as well as real human capacity and capability. Next, please. Right. So, as I was saying, we must be fully aware that academia should be the catalyst of change and the game changer to make sure that we do not been drifted into the world of digital, which have got negative impact if we're not fully aware. Next, please. Okay, next, please. These are all the role of academia. Next, please. Next, please. These are all just okay. I'm not going to go into too much detail because I think I've taken a lot of time already. Just to mention that in my one of my work is going towards digital education delivery system and introducing new module. And like I mentioned just now, quite clearly engaging on the thing what we term as the digital emotional intelligence and psychological enhancement. Next, please. Next, please. Right. Some of these things that we have done in this country is simulation based. In Malaysia, is simulation based learning. Next, please. We use a lot of this technology to do a lot of what we term as technical ability and more emphasizing on skill. Next, please. So you know about augmented reality. Next, please. Okay, now this is important that though we use the technology, but it all activating the part of brain for the interpretation and skill. But this is just the beginning of it. But soon after this, we have to bring them out to the what we term as to the field for them to start practicing their skill. Now, this one thing, the good advantage about this one is they can do what we term as self-learning, self-learning. Okay, next please. Next please. Okay, next please. These are all some of the technology that we have already seen. I just want to put up to you that many of these technology have gradually replaced the traditional way of learning. But while this is all good, but there must be a good balance between this and skill development. Okay, this is some of the pictures of the simulation center in Malaysia. Next, please. So many of the Malaysian university have created a simulation center for them to have skill, technical skill, rather than a lot of lectures and theory and academic. Next, please. Next, please. Next, please. These are all pictures of the simulation center. There's another university with this simulation center. Next, please. Next, next. Yeah, next, please. All right, so this is important to conclude. We have to emphasize on this 6C personality. Now, understanding this perspective, it will be our agenda for developing the young. The 6Cs include confident, capable and competent, committed, connected, that they have to have network, they have to know people rather than only the computer and only the software system or whatever content in the digital world. They have to be connected with real people. Next, please. And of course, communication skill. This is so crucial that nowadays the way their digital language is completely different from the real language. And I just want to emphasize a very important point, that this caring perspective of doctor or those frontliner or practitioner is grossly lacking if they are engrossed in the world of their own. They become very self-centered, isolated, and precisely why many young doctors fail in their career because of lack of caring. Next, please. Right. In summary and conclusion, I just want to conclude, but all of us who are involved in academia must realize that digital transformation medical education is important to emphasize on skill and competency without compromising the emotional intelligence. The most important role, the role of the catalyst and agent of change for this policy of educating, fully aware, a good balance of digital world, digitalization compared to the yesteryears when this is not so big and significant. Henceforth, we want to create a situation where there is a balance of the real world versus the digital world. So, in conclusion, of course, I would like to say that digital transformation of healthcare, digital transformation of medical education, and so on and so forth is all very, very important and almost inevitable that we have to move forward to deal with this. But please be aware of the negative impact of digital network and digital world, that there must be a good balance in order for us to preserve the real emotional intelligence, the ability to interact with the people, and so on and so forth. So, next, please. I'd like to thank you all very, very much for opportunity for me to share. Just to conclude, but the predicting of the future training is insufficient, but we must shape the future for the benefit of the public and our patient and our profession. Vision without action is an opportunity lost, while the future holds many challenges and countless opportunity for our training program. Thank you very much for the kind attention, and it has been a great pleasure for me to do this sharing. And I'm very, very happy that I managed to share my work that I'm now presently doing and what we term as the utilization of healthcare, and of course, understanding the impact, which is both beneficial and also negative. Thank you very much. Thank you.
Thank you, Doctor. Thank you very much for the inspirational, thought provoking, and a very, very informative talk, which is really very useful to the young doctors and the researchers. We are very happy that we were able to get your time, valuable time, and you have spared your valuable time with us on this occasion of international conference for sharing different thoughts and your experience to all our research community in India as well as abroad. Thank you, Doctor. Thank you very much.
Thank you very
If
much.
there are
Thank you.
any
My pleasure.
questions,
It's my pleasure.
yes, sir. Yes, sir. Thank you, sir. If there are any questions from delegates, you can please ask, Doctor. Delegates, you can ask questions from our speaker. Or in case if you have questions, you can even mail to us. That will be forwarded to our doctor, and you will get
No
a
problem.
reply from him. I
Yeah,
thank
please.
one
If
and
you,
all
you can
for.
text me. Yeah, definitely. Definitely.
Thank you,
I
doctor.
will be able to handle that. Thank you
So,
very much.
on behalf of New Rains, I thank you, doctor, for all your support to this international conference and
Thank
for
you.
joining and delivering a excellent talk on this occasion. Thank you, doctor. Thank you
Thank
very
you
much.
very much. Okay.
Thank you. So, I would like to shortly introduce our the second speaker for the international conference, third day, Dr. Jaisilan Senthinath, MD. He is a professor in microbiology with more than 15 years of teaching, diagnostic, and research experience. He has been in various administrative positions at various medical colleges, and he had been chairperson of Infection Control Committee at various hospitals. He has presented invited talks at various conferences regarding infection prevention and control. Presently, he is serving as professor and head of the Department of Microbiology, and he is the chairperson of Infection Control Committee at a medical college and hospital in Tamil Nadu. I warmly welcome Professor Dr. Jaisilan Sendinath. Sir, we are happy to have you here today for the second session of the third day international conference, AIMSEM 2024. Thank you, sir. Kindly take over the session.
Sure, sir.
Yeah. Sir, please go ahead, sir.
Yes, sir.
Yeah.
Good morning, sir. Good morning, everyone. Sorry for the inconvenience, sir.
So,
I had
no
a
problem,
problem,
sir.
a
Kindly
technical
continue.
problem. First, I thank Dr. Deanery, Dr. Comrade, sir, for granting this wonderful opportunity. I also thank uh, Professor Dattoshri for his wonderful presentation. Any presentation after his wonderful presentation will be an average one. I could have asked Dr. Kamaraj, Professor Dr. Kamaraj, for a presentation for a slot before his presentation. Anyway, I'll start with my presentation. My topic is implementation of artificial intelligence in diagnosis of tuberculosis. Uh, Tuberculosis. To start with, I will give a brief on the tuberculosis and its treatment. Next slide, sir. Next
Next
slide.
slide, Palak.
So, tuberculosis is caused by a bacteria called Mycobacterium tuberculosis. It's a rod-shaped bacteria, and this is the image of Mycobacterium tuberculosis when it is visualized under the microscope. Next slide. Tuberculosis, this Mycobacterium tuberculosis was first identified by Dr. Robert Koch in 1882. He is termed as the father of medical microbiology, and he won Nobel Prize for this wonderful discovery. Next slide. Now, tuberculosis is not a recent disease. Evidence of TB has been detected in human remains dating thousands of years back. Next slide. Even in India, tuberculosis has been mentioned in Vedas thousands of years ago. Next slide. So, treatment of tuberculosis, it's also not a new concept. Thousands of years ago, Shushruta, the father of Indian medicine, he had tried treating tuberculosis patients with breast milk, alcohol, meat, and rest. So, during the period of Shushruta, a person with tuberculosis can go for a treatment with Shushruta, have alcohol, have meat, and relax and rest. Next slide. In the current scenario, we have various antibiotics to treat tuberculosis. We have BCG vaccine to prevent tuberculosis. Next slide. And along with that, WHO has advocated various TB eradication programs, and our Indian government has launched the National Tuberculosis Elimination Program, which aims to eliminate tuberculosis as a public health issue by 2025. So, tuberculosis is not a new novel disease. The treatment for tuberculosis is not a novel one. We have antibiotics for tuberculosis. We have vaccination to prevent tuberculosis. And we have various public health measures, various programs by WHO and Indian government to eradicate tuberculosis. But tuberculosis is still a global health problem. Next slide. It's one of the top 10 causes of death worldwide, and it's the leading cause of death from a single infectious agent above HIV. Next slide. So, as I told you before, we have antibiotics, we have vaccinations, we have various programs to control tuberculosis, but still we have challenges in control and eradication of tuberculosis. The first reason is delay in detection of tuberculosis. The second reason is emergence of drug resistant strains. During the COVID pandemic, we had seen a lot of strains emerging every 3 months, a lot of resistant strains emerging every 3 months. Similarly, in tuberculosis, we have emergence of drug resistant strains and co-infection with HIV or COVID. After the COVID pandemic, there has been a sharp rise in the number of tuberculosis cases, both in India and abroad. And the reason is the immune system is compromised due to HIV or COVID, and this aids in easy entry of the tuberculosis bacilli into the body. And finally, the bureaucratic barriers to access healthcare systems. Next slide. Now, the only solution for this problem is early detection of tuberculosis. By early detection of tuberculosis, we can overcome all these hurdles to eradicate tuberculosis. So, the importance of early detection of tuberculosis, number one, you go for a timely initiation of treatment, so you reduce the severity of symptoms, you reduce the complications, and your patient gets better, and it improves the overall health outcomes for patients. Next slide. Tuberculosis is airborne, like coronavirus, and so prompt diagnosis and treatment, it reduces the period of infectiousness, and so you break the chain of transmission. Next slide. By early diagnosis, you reduce the morbidity and mortality of tuberculosis, and you also prevent the disease progression. Tuberculosis always present in new two ways. One is latent tuberculosis, and the other is active tuberculosis. In latent tuberculosis, you have the bacilli, you have the infection in your body, but you don't have symptoms. If you are treated at this stage, you don't move on to the active tuberculosis stage. So by early detection, you prevent the progression from latent infection to active disease. Next slide. And again, you reduce the morbidity and mortality associated with tuberculosis by early diagnosis. And these early detection measures, it contributes to your success of TB control programs. Next slide. Cost effectiveness. So early detection, so your symptoms are reduced, your complications are reduced, so you don't have a prolonged hospitalization, and you need not go for an extensive treatment regime. So this reduces healthcare costs. Especially this is advantages in developing countries. Next slide. So, diagnosis of tuberculosis. The conventional methods diagnosis of tuberculosis is rather very simple. Number one, microscopy. You take a sample from the patient, you examine it under the microscope, and you look for the tubercle bacilli. That's it. Number two, next slide. TB culture. If you suspect a patient is having tuberculosis, you take the sample from the patient and you streak it in Lowenstein Jensen medium. This is a medium which contains growth factors that enhances the growth of tubercle bacilli. So simple, you take a sample, streak it in Lowenstein Jensen medium, and you look for the growth of tubercle bacilli. As you see here, the tubercle bacilli has grown in this medium. So if there is a growth in this medium, you term that the patient is positive for tubercle disease. Next slide. Radio diagnosis. So tuberculosis, it leaves typical lesions in your lung, like cavities or nodules. So, by taking an X-ray or by taking a CT scan, a radiologist can easily interpret whether a patient is having tuberculosis in his body. Next slide. And finally, molecular diagnosis. So, molecular methods. Here, what you do is you take a sample from the patient and you look for whether the genome of tubercular bacilli is present in the sample. Either DNA is present or RNA is present. By doing a PCR or a NAT or a gene expert, you can identify whether the gene of tubercle bacilli is present in that sample. It's a easier and rapid method to identify tuberculosis. So, the what all diagnostic methods I enumerated about tuberculosis may look simple, may look easier, but we have some problems with these diagnostic procedures. We have some limitations. Next slide. So, the limitations in these diagnostic methods. Number one, so variability in test sensitivity. So, the sensitivity of these tests is reliable on the quality of the sample collected. For example, the sputum sample is the most common collected sample for diagnosis of tuberculosis. So we need the sputum for diagnosing tuberculosis. But most of the patients, when not properly instructed, they produce their saliva, and saliva does not contain adequate tubercle bacilli. So we may miss it in microscopy, and we may miss it in culture, and similarly we may miss it in molecular methods. So the sensitivity of these tests is dependent on the quality of the sample. So there is a variability in test sensitivity if the quality of sample is not adequate. Next slide. Now, you need skilled technicians to perform microscopy, to perform a culture, and you need a radiologist to interpret your X-ray or a CT scan, and you need a lab technician who is trained in molecular diagnostic techniques to interpret these molecular techniques. So, there is a dependence on skilled technicians. Next slide. Next slide. And the turnaround time is long. For a culture, to grow Mycobacterium tuberculosis in the lab, it takes 7 weeks. So, when you declare a patient that is positive for tuberculosis after 7 weeks, the patient goes in for an advanced stage. So, your diagnosis may not help the patient. Similarly, we have rapid diagnostic kits for other diseases, say for HIV or hepatitis or HCV or malaria or a typhoid. We can interpret within few minutes. But for tuberculosis, we have no rapid diagnostic tests, and the only rapid test is this molecular methods, NAT and gene expert, but it also takes hours to go for a diagnosis. Next slide. So, the current challenges in TB diagnosis: number one, as I told you before, the variable sensitivity of the traditional diagnostic methods. Number two, cost. CT scan and molecular methods, they are rather very costly, and limited access to newer technologies. So, in resource poor settings, you can't get access to newer technologies like these NAT and gene expert, and we need specialized tests to identify drug resistant TB strains, and it may not be available in poor resource settings. And when you have a co-infection with HIV or a COVID, your symptoms may not be very clear, so you cannot diagnose with the symptoms, and the disease progression is more due to immunosuppression. Next slide. In pediatric patients, usually they don't come with the typical presentation of tuberculosis like cough, loss of weight, or cough in blood in sputum. So they come with non-specific symptoms. So either the parents or doctors, they may miss the diagnosis. Similarly, you need a good lab for diagnostic tests like culture and NAT molecular diagnostic tests, and you need a trained healthcare personnel to perform these diagnostic tests for tuberculosis. And the most important thing is, still tuberculosis is considered as a social stigma. Still, people fear that a patient with tuberculosis can transmit the infection to them very frequently. So, a patient who has symptoms of tuberculosis, in the fear that he may be discriminated from the society, he may not go for a treatment or diagnosis. So, this is another factor. So, these are the main reasons. Next slide. Next slide. Next slide. So the only solution for early detection of tuberculosis is implementation of artificial intelligence in diagnosis of tuberculosis. To start with, microscopy. So digital microscopy. For conventionally, when I want to diagnose tuberculosis using a microscope, I collect sputums on the patient. I do a staining method called Z-Nielsen's technique, and then I examine it under the microscope. For declaring whether a patient is positive or negative for tuberculosis, I have to examine 100 fields under the microscope. Now, this takes time and this needs expertise. So, with automated digital microscopy, the detection process is very easier. It reduces the reliance on skilled human technicians, and I can speed up the diagnosis. Next slide. Next slide. Second thing is automated chest X-ray and CT scan analysis. Using convolutional neural networks, I can analyze chest X-ray and CT scan to detect TB. And the most fascinating thing is AI can detect tuberculosis in X-ray and CT scans more than humans. Next slide. In molecular diagnostic methods, as I told before, in Gene Expert and TrueNAT, it can enhance the detection of TB bacteria. The integration of AI can enhance the detection of tuberculosis bacteria. Next slide. By natural language processing, it can analyze clinical loads and electronic health records to identify potential TB cases and initiate treatment. Next slide. So the most happening thing is telemedicine, especially where the resource settings are very poor. So AI tools can be integrated into telemedicine platforms to provide remote TB screening and diagnosis, as I told you before, especially in rural and undeserved areas. Next slide. Again, this is the most happening thing nowadays. Using mobile to detect and diagnose tuberculosis. We will go in for detail in the coming slides. So using AI powered mobile apps, we can go in for TB screening and monitoring. It can provide a preliminary diagnosis based on AI analysis. Next slide. Genomic sequencing, especially in drug resistant bacteria, AI algorithms can analyze genomic data, and this can help to go for an effective treatment regimen and managing drug resistant TB patients. Next slide. And for public health surveillance, AI can be used to track and predict TB outbreaks, and it can also provide timely interventions. Next slide. For research, for development of new diagnostic methods, for development of new vaccines, and new treatment modules, AI can be used for analyzing large data sets to identify potential drug targets and biomarkers. Next slide. So, the potential benefits of AI in TB diagnosis. Number one, it improves accuracy. First, for enhanced image analysis in an X-ray or a CT scan using convolutional neural networks, AI can detect TB abnormalities like nodules or cavities, which that can be missed even by a competent radiologist. Next slide. And uh, the next thing in improving accuracy, AI-driven analysis of NATs can improve the detection of mycobacterium DNA or RNA. As I told you before, in molecular methods, we look for the DNA or RNA of Mycobacterium tuberculosis in the sample of the patient. So, the precision of these molecular diagnostics can be enhanced by implementation of AI. Next slide. So, the turnaround time, we saw before that the turnaround time by conventional diagnostic methods is very long. Here, by using AI, we can speed up diagnosis both in automated screening, next slide, and next in digital sputum microscopy. So I can go for a rapid identification of TB bacteria and sputum samples using digital sputum microscopy. Next slide. Increased accessibility. So I can go for a point of care testing in rural areas where there are poor resources or where there is a lab is not available. Similarly, I need not depend on a skilled technician. Uh, the average technician can perform this diagnostic test with the help of AI systems. Next slide. Personalized medicine. Now, this concept is becoming popular. You tailor your treatment plans according to the patient. So AI driven predictive analytics can analyze patient specific data and it can personalize TB treatment regimens according to the individual. So this can bring about better theory outcomes and it reduces the risk of drug resistance. Next slide. So support to the public health effects. So early detection of outbreaks. This can prompt public health responses and containment measures. Similarly, AI-powered analytics, it can track TB incidence and treatment, and this provides insights for policymakers to refine TB control strategies and allocate resources effectively. Next slide. Now, so implementation of AI in diagnosis and tuberculosis is a very fascinating thing. So you may think that you can eradicate and control TB by applying artificial intelligence in diagnosis of tuberculosis. But we have to take in consideration these ethical problems in AI-driven diagnosis. Number one, AI system, they require access to your personal data. So your personal data will be in the open. So this affects data privacy and your data may be misused by a third party. Now how to mitigate it? So you implement robust data protection measures like encryption, anonymization of data, and adherence to privacy regulations. And you make sure that only authorized personnel has access to these health information. Next slide. The next ethical consideration is obtaining informed consent from the patient. Our patients who are partially literate or who are from the rural side, they may not understand the implementation of AI in the diagnosis and treatment, and they may refuse informed consent. To overcome this, we have to educate patient about the role of AI in TB diagnosis, its limitations, its benefits, its potential risks, and then we can obtain an informed consent. Next slide. Now, the fear every human being is having nowadays is that artificial intelligence may replace humans in every field. The same fear is in medical field also. So, healthcare professionals they are in a fear that AI systems may replace them in the future. So, to overcome this fear, we have to educate healthcare professionals that AI is just a complementary tool to support clinical decision making, and it cannot replace healthcare professionals. And we must ensure that healthcare professionals receive adequate training in using AI technologies and interpreting AI generated results effectively. Next slide. So, as we know, AI-driven TB diagnostic methods may be very costly, and so cannot be made available in rural areas. So, this exacerbates healthcare disparities. Now, to overcome this, we can develop AI technologies that are inclusive and adaptable to diverse socioeconomic and cultural contexts. Next slide. Now, the future in AI, using your mobile for TB screening. Now, how do we do that? First, remote symptom assessment. So you provide your users with a questionnaire to evaluate the risk factors and symptoms of TB, and you can analyze that, and you can identify potential TB patients. So you can advise them to go for timely treatment. This enables early identification of individuals of risk of TB, prompting them to seek further diagnostic evaluation or treatment. Next slide. Cough analysis. By using machine learning models, you can analyze your cough sounds by sound pattern recognition and classification. So this is a non-invasive and cost-effective method for preliminary TB screening, especially in remote areas and resource-limited settings. So just you cough out in your mobile phone, and analyzing these sound patterns, we can identify tuberculosis, and we can advise you to go in for a prompt diagnosis and treatment. Next slide. Using your mobile app, you can send your x-rays or CT scan images, and this AI enabled mobile apps can analyze images of abnormal chest x-rays or CT scans, and this by this you can diagnose tuberculosis in a remote way. Next slide. Next slide. Yeah. In educational and behavioral support, you can disseminate information about tuberculosis to your users, tailored to your users' language preferences and their literacy levels. So this empowers users to take proactive steps towards TB prevention and management. So this reduces the social stigma associated with tuberculosis, and it promotes community engagement in TB control efforts. Next slide. So teleconsultation, as I told you before, this is most happening thing in medical field now. So we can have virtual consultations with healthcare professionals using your AI-driven mobile apps, and we can have remote diagnosis and treatment initiation, and you can easily monitor your TB patients. Next slide. So uh, that's I come to an end with it. So integration of AI in diagnosis of tuberculosis can aid in the control and eradication of tuberculosis, but even then it has its own limitations, and we need further research in this field to develop AI in the diagnosis of tuberculosis. Thank you.
Thank you, Doctor. Thank you for the nice presentation.
Thank you, sir.
I hope this would have helped the young researchers doctors, scientific researchers, and computer professionals, computer engineers, for going ahead in their data systems, the technologies. Thank you, Doctor. Thanks for sharing your valuable information and sharing your time with us in delivering an excellent talk to our participants in the international conference AIMS 2024. Thank you, Doctor. Thank you.
Thank you, sir. Thank you for granting this great opportunity, sir. I thank the all the viewers for their uh, for
Thank you.
viewing this presentation, sir.
Thank you,
Thank you,
sir.
sir. Thank
Is
you.
there any question from delegates to Doctor? Doctor, I have a question.
Yes, sir.
Uh, what is the earliest possible time by which you can detect or confirm tuberculosis?
So by molecular
Possible.
methods,
Uh,
possible. By molecular methods, it takes 4 hours to 5 hours to identify tuberculosis.
so that
By
is yeah, that is the time of your analysis. My question
Yes, sir.
is,
Yes,
I'm
sir.
asking
Yes,
how
sir.
early we can detect. What could be the earliest stage by could you could confirm a
Sir,
person is having tuberculosis?
whenever a person is having symptoms of tuberculosis,
Okay.
like cough or a rise in temperature
Hmm.
or unexplained loss of weight or loss of appetite,
Okay.
if he comes for a diagnosis,
Hmm.
we can diagnose it immediately in the early stages itself, sir.
Okay. That means once a person feels it, it is possible to diagnose
Yes, sir.
positive or negative.
Yes, sir.
Okay. Okay.
But
Thank
we
you.
can screen high risk populations for tuberculosis.
Okay.
Say in India, potentially we are exposed to tuberculosis because of
Yeah.
overcrowding and malnutrition. So here we can go for a mass screening and identify, irrespective of whether patient is having symptoms or not.
Okay. Okay, sir. Sir, what will be the cost for these tests and how long it will take for I mean, how long it will require to undergo treatment for a person who is having.
For in resource poor settings in a primary health center, we use microscopy, and the cost for a microscopical examination of tuberculosis will be just 100 rupees.
Okay.
And for a culture in your well set lab, it will be around 750 to 1000. And for CT scan and X-ray, you know the cost for that.
Yeah.
For molecular methods, it comes around 6,000, 5,000 to 6,000. But in government hospitals, it's just 1,500 to 1,600.
Okay. Okay, doctor. Thank you, doctor. Any more questions from delegates? You can kindly ask.
So another information, sir.
Yes, sir.
In our country,
Yeah.
uh, according to the National Eradication TB Eradication Program, Elimination Program,
Yeah.
they are doing it free of cost in government hospitals.
Okay. Okay, sir.
All the tests. And you asked for the duration of treatment. The duration of treatment is 6 months.
Okay. Okay, sir. Uh, someone raised hand. I don't know. Okay, doctor. Thank you very much. If there are any questions from delegates, you can even convey us. We can get back to you through mail from doctor. Thank you, doctor. Thank you for joining
Thank you,
us.
sir. Once again, thank you, sir. Thank you
Thank you,
for
sir.
granting
Thank
this
you.
opportunity. Thank you,
Thank you,
sir.
sir.
Thank you, sir.
So thank you, delegates, for listening to the invited talks. Two invited talks from two doctors, reputed doctors, Dr. Abu Hassan, member Malaysian Medical Council, Malaysia, and Dr. Jayasilan from Dhanlakshmi Srinivasa Medical College and Hospitals, professor and head of microbiology. Thank you very much.